Get ready for a paradigm shift in blood pressure management. The latest guidelines from the American Heart Association and the American College of Cardiology are here, and they're taking a more proactive approach to tackling high blood pressure. If you've been living life on the edge with your blood pressure readings, these new guidelines might just give you a nudge towards a healthier lifestyle. And if you're a fan of an evening tipple, you might want to sit down for this one. The heart of the matter, a new approach to blood pressure control. The Heart Organization's committees have been hard at work, reviewing the latest research to provide medical professionals with the best strategies for managing high blood pressure. And the results are in. These new guidelines, the first since 2017, are a game changer in the fight against heart disease, the world's leading killer. Nearly half of all adults in the U.S. have higher than normal blood pressure. And these guidelines aim to address this issue head-on. The goal remains the same. Normal blood pressure is less than 120/80 mmHg, with elevated blood pressure ranging from 120 to 129 ratio of 80 mmHg. But here's where it gets interesting. If your blood pressure reaches 130 to 80 mmHg or higher, your medical provider will likely suggest some serious lifestyle changes. Blood pressure is measured in millimeters of mercury, mmHg, with two key readings, systolic, the upper number, and diastolic, the lower number. Systolic pressure measures the force of blood as it leaves the heart, while diastolic measures the pressure when the heart is at rest. High blood pressure, often symptomless, can lead to serious health issues if left untreated. It puts strain on your blood vessels and heart, increasing the risk of heart attacks, strokes, and other cardiovascular diseases. A new approach to treatment. The new guidelines recommend an earlier start to treatment for those with systolic blood pressure between 130 and 139. Instead of jumping straight to medication, as was previously recommended for systolic blood pressure above 140, the focus is now on healthy lifestyle changes. Your medical provider will encourage you to adopt these changes for 3 to 6 months, and if your blood pressure remains high, medication will be the next step. Dr. Daniel Jones, chair of the American Heart Association's writing committee for these guidelines, emphasizes the importance of this shift. We're trying to be more aggressive in controlling blood pressure to prevent cardiovascular diseases, strokes, and kidney disease. And now we know that lowering blood pressure can also reduce the risk of dementia. It's a significant development. Lifestyle changes, the key to success. The new guidelines emphasize the following lifestyle changes: maintaining or achieving a healthy weight, adopting a heart-healthy diet, reducing salt intake, managing stress, engaging in at least 150 minutes of moderate physical activity per week, including resistance exercises like weight training. But there's a twist. The guidelines also recommend abstaining from alcohol. Previous guidelines suggested 1 drink or less per day for women and 2 or less for men. But the evidence now points to alcohol's negative impact on blood pressure. Dr. Jones encourages an informed decision. A lot of people enjoy drinking, but with the evidence we have, we want people to be aware of the impact. There's variability, but our ideal recommendation is abstinence. For those who choose to drink, it's less than 1 for women and less than 2 for men. The link to dementia. With growing evidence, the guidelines also highlight the importance of lowering blood pressure to reduce the risk of dementia. This is especially relevant for women, as studies show that high blood pressure during pregnancy can have long-term effects, increasing the risk of elevated blood pressure post-pregnancy. Dietary recommendations. Dash to the rescue. The DASH diet, high in fruits, vegetables, whole grains, fish, poultry, beans, nuts, and vegetable oils, and low in fat, sugar, and tropical oils like coconut and palm oils, remains a key recommendation. Dr. Jones emphasizes the importance of limiting sodium intake and increasing potassium intake. A simple way to do this is by using potassium-enriched salt substitutes when cooking at home. Weight management, a critical component. For those with overweight or obesity, the guidelines recommend losing at least 5% of body weight. For more severe cases, clinically proven interventions are suggested, including diet and exercise, and weight loss medications like GLP-1s. In very severe cases, surgery may also be recommended. The challenge and the reward. Dr. Jones acknowledges the difficulty of maintaining healthy blood pressure levels in today's food environment. However, he emphasizes the significant health benefits of taking these steps. It's a challenge, but it's worth it. Eating right is the first line of defense against high blood pressure, and while it's hard to resist sodium and alcohol, the good news is that these lifestyle changes work if you're willing to make them. So, are you ready to take control of your blood pressure and embrace a healthier lifestyle? These new guidelines provide a clear path forward, and with the right choices, you can reduce your risk of cardiovascular diseases and live a longer, healthier life.